All right, thank you for joining us today for today's installment of Lunch and Learn. Today, we're going to be talking about how to participate in Medical Cannabis Awareness Week, which starts this Saturday. It's a week-long opportunity for you to participate in some of the existing actions that we have at Americans for Safe Access. It's also an opportunity for people to look at their own network and maybe look around to see if there are people that you were working with 5 years ago that maybe you haven't seen in a while, and really do some in-reach, which, yes, is the opposite of outreach. But this is also an opportunity for you to get familiar with some of the resources at ASA. And so I'm going to walk you through some of the events that will be going on and uh, offer, some suggestions of things that you can do during Medical Cannabis Awareness Week. This is also just a time, if you haven't taken some of the actions at ASA, to, write your member of Congress, to send out some information about ASA membership over your network. So let's jump in. So the context of Medical Cannabis Awareness Week this year is, that there is a lot going on Capitol Hill. There's obviously some major changes happening in the executive branch, new leadership within Congress. And, I think for the last few years, there hasn't been a lot of significant activity on Capitol Hill around medical cannabis. And so people have maybe, have really focused more on their state work, or maybe feel like there's nothing for people to do right now. But there's a lot of things sort of coming to a head right now on Capitol Hill around cannabis policy that is going to impact medical cannabis. And so this is really, I'm hoping during Medical Cannabis Awareness Week, we can really renew our commitment to this work, and find old colleagues and get them up to speed about what's going on in medical cannabis, as well as really prepare for both being on the defensive and offensive around medical cannabis policy. So we have issues coming to a head around the hemp bill. There's the sort of lingering rescheduling petition, but there's also some attacks towards our federal protections for the medical cannabis programs. So last session, we saw Republicans in the House take a swipe at our CJS amendment, which is an amendment to the Department of Justice appropriations bill, that keeps them from enforcing federal laws. And I think people maybe didn't get as alarmed when that passed last year, because we had allies on the Senate side, but now the Republicans have control of the Senate, but they also not only do they have control of the Senate, but actually the biggest anti-cannabis elected officials are actually in leadership positions that could, carry out whatever happens in the House. So, we see that there's a very anti-cannabis appointment in the DEA. Project 2025, which is sort of the opius behind a lot of the leadership in the Trump administration, has laid out that they want to start enforcing, basically go over states and local communities that have softened their policies on cannabis. And we also saw, a lot of legislation that inadvertently could really harm medical cannabis by putting cannabis policy in the FDA. There's also a lot of media right now about the harms of cannabis, and this is all sort of being told out of the context of medical use. So when people hear that people are using cannabis every day, and they're seeing that only through a prohibition sort of frame, they're not understanding that a lot of those the people that are using cannabis every day are doing so to treat serious conditions. We know from our lobbying efforts last year that even our champions are really confused about what's going on with medical cannabis patients. So, and I'm not even talking about our opponents. This is our, people who have traditionally voted for medical cannabis policy, that they are under the impression that, Schedule 3 will just solve everything for patients, or that patients are being served by the adult use and hemp markets. But we also have a lot of positive, things to convey both to the media, to the public, and to the new Congress. And so they may not understand that while the rescheduling process hasn't finished, that what is really important for patients is that HHS and FDA have found that there is accepted medical use. And so we're hoping to really echo that, right? They may not understand that at this point, like there's only one state left that doesn't have some type of medical cannabis law. They might not understand that actually the legislation that we are hoping to pass to create a new Office of Medical Cannabis and a new schedule for cannabis is actually, being echoed um, in organizations that actually guide Congress, like the Congressional Research Service. They may not know that there is bipartisan support for cannabis, or that, again, the deepening the information about people that are using cannabis every day, that we're actually seeing, patients substituting cannabis for opioids, for sleep aids, for muscle relaxants. Uh, I think that one of the, more exciting things that we're seeing is that there's more healthcare stakeholders that are getting involved, as they're seeing things like the impact of cannabis on pain treatment, and, looking at the sort of not only the healthcare crisis that we have as far as the health of individuals in our country, but also the cost of these untreated conditions. And you may not know this, but now there are 2/3 of clinicians in this country um, believe that there is some medical use to cannabis. And so I think this is really a time for us to, solidify our own commitment to advancing medical cannabis policy, but really, echoing that there is a solution, and really finding those people who agree with us and helping them see how they can get active. So we have our Patients First campaign. Uh, this is obviously modeled after some of the Trump language for his campaign. But this is, an opportunity for the first 100 days of the Trump administration for him to take action. And also a time for us to welcome the freshman class of the 119th Congress. And really, educate them all about what a national medical cannabis program would look like. And so for Medical Cannabis Awareness Week, you can go onto our website and actually sign up. There's a sign up for individuals, and then there's a sign up for organizations. And you can sign up to, we're going to have a series of trainings for advocates. So you can go on and sign up for whatever trainings you'd like to have, whether talking to the media, talking to elected officials, if you're doing organizing in your community, we'll have a training on coalition building. And so, obviously we're not gonna be able to do all of these trainings during Medical Cannabis Awareness Week. So we're going to see sort of what individuals are hoping for and put those trainings on during the week. And then we also, on the 19th, which is a Wednesday during Medical Cannabis Awareness Week, we're going to have a day of action of educating our senators. So during Medical Cannabis Awareness Week, your senators and members of Congress are going to be at home. They're going to be in your district. And so some people are going to be actually going to their Senate offices, delivering materials about the federal legislation. Some people are going to be doing, call-in days. And then, during Medical Cannabis Awareness Week, we're going to have, social media education campaigns. We have a petition. We're hoping people will sign up to really help get more signatures on that petition that we're hoping to deliver May 1st in DC. Uh, where obviously the more members we have, the more we can do, the more we can, more staff we can hire to carry out these campaigns. So we'll be doing a membership drive, and we have media outreach opportunities, the advocacy trainings, of course, and then we're going to be having some volunteer days of, just working within some of the projects and programs at ASA. If you have a few hours that you want to dedicate to volunteering during that week. And then for organizations, similar campaigns, but you can sign up to actually host some of these activities, like the petition drive or the membership drive. So for the membership drive, anyone who donates to ASA becomes a member. Our membership is $35. And we will actually be having our members only meeting on February 22nd. So this is where we kind of lay out our plans for the year and get feedback from our membership. And so it's always a sort of carrot to get people to sign up. A lot of people think that they're a member, or they became a member years ago, and they're not sure. So we've created this tool, just safeaccessnow.org, member check, and you can actually go onto this page and check to see if your membership is active. This is a great tool for if you're doing outreach and people are like, I'm not sure if I'm an ASA member. You just pull up this and they can see right away. I think a lot of times memberships lapse, not because people don't want to be a member, but they get busy or miss the email to renew their membership. And then we have a lot of activities that that could actually take up a month, if we had Medical Cannabis Awareness Month. So on our website, on the Patients First page, we have all of these actions. So everything I'm going to be showing you right now is on this page. But we have a letters to the editor campaign. So if you've never written a letter to the editor, this is a great way to get the message around medical cannabis to a broader audience. And there's, some tricks to getting a letter to the editor published. And so we've created this resource page for you, including there's, tips on how to write a letter on there. We've actually, there's a database of the major papers in your area. So we've even put that together for you. And then we've created sample letters to the editor. We also have several actions, that are, within the power of Trump to actually actions he can take without Congress. And for each one of these items that we'd like Trump to take an action, there's actually a social media share. There's also, the handles for the appropriate people overseeing, so for the veterans, there's actually a handle for the head of the new head of VA that you can just copy and paste into X or Facebook. And these images you can download and put on your social media page. So there's 5 of those actions. So you could do one a day and be doing something every day during Medical Cannabis Awareness Week. We also have this petition that we're trying to get as many signatures as possible before May 1st. We'll be delivering this to Trump directly as well as to Congress. And so if you haven't signed, so you can sign yourself, or you can, decide within your organization or just amongst friends that you know set a goal of trying to get 100 people to sign the petition. And again, all of this is already done for you. You can just copy and paste and put it into your social media, or email it to your friends. And we're also, you know, again, trying to get information in front of the new Congress. So even if you think your member knows about cannabis, you know, our experience from last year being on Capitol Hill is they don't necessarily know what the priorities of patients are. And so, you know, if you go on to this page, we've done all of the work for you. You just put in your address, and actually it'll pull up a sample letter for you to send to your two senators and to your member of Congress. So all you need to know is your address right here, and it'll pull up the rest of the information for you. And so you can take this action. Once you do it, you'll see how easy it is, and encourage your network to do it as well. And then we also, for each of these actions, we have social media shares and even language you can drop into your social media share to encourage your network to take action as well. Uh, and then we also, you know, during Medical Cannabis Awareness Week, might be a great time for you to see what resources we have at Americans for Safe Access. So if you haven't been on to ACE's YouTube page, you know, this webinar that we're doing right now will be on there. But we have not only, you know, this series for the Lunch and Learn, but we also have, you know, every presentation from our national conferences are on there. We have, you know, a series like last year we did an educational series where we did deep dives into, you know, various medical cannabis issues. So, you know, during Medical Cannabis Awareness Week, you know, take some time and get familiar with what resources we have at Americans for Safe Access and how you can utilize those in your network. We also, one of the other campaigns that we have is our educating consumers and patients about what is in their cannabis, making sure that patients are making informed decisions about their medicine. And so we have these great new guides for patients and consumers. These are in both Spanish and English. And so, you know, there's also social media shares for these as well. If you want to let your network know about these. And, you know, feel free to, you know, take any of the materials we have at Americans for Safe Access and incorporate them into your own work. Right? You know, Americans for Safe Access is a umbrella for everyone working on medical cannabis policy. And so, you know, we're here to create materials and resources to help you in your advocacy. We also have, you know, a whole section on our website of the Know Your Rights. These are in both English and Spanish. So, you know, take a minute, look through our website and see if there are resources that can help the work that you're doing now. And then on every page of our website, we have this is at the bottom. And so if you are looking for something on our website and see something that, you know, is a resource that you didn't know was there, that you want to share with people, you can always, you know, just, you know, share it directly to your social media share and let people know, you know, about this resource or ways to incorporate, you know, these resources again, into your own advocacy. So we're also calling on organizations to endorse our legislation. So if you're a member of an organization that is working on cannabis or is you know, friendly to medical cannabis, maybe utilizing Medical Cannabis Awareness Week as an opportunity to reach out to organizations that you work with and ask them to endorse. This web page You can share with organizations. They may not be ready to endorse, but they may just want more information. And they can actually, sign up to get an ASA staff member to present the legislation to the organization. And this also is a good time to familiarize yourself with the legislation. We've created new tools, to answer people's questions about what the legislation does. So this is an opportunity to maybe within your own chapter or affiliate or your organization, take some time within a meeting to discuss the legislation, to see what their questions are. And we are also, next week, we'll be issuing some new materials. So we have a new briefing guide for Congress that is sort of putting all of these various, cannabis issues together from the perspective of patients. And we, of course, have tools like our citizens lobbying trainings and resources to prepare you for those activities. And if you wanted to drop into your, your local offices of your senator or congressman, you can download resources around uh, the legislation around patient issues to help with those meetings. And during this week, it's also a time to connect with other other people that again are in your network, or people that maybe you were working on a state campaign with a few years ago and they kind of fell off. So I think right now our biggest challenge for medical cannabis is that people don't know that there's still work to be done. And that's true of the broader public and of our elected officials, but it's also true of people who consider themselves medical cannabis advocates. So we hope that you uh, take a moment, sign up for Medical Cannabis Awareness Week. I'll be posting this webinar up on our YouTube page, and I'll include in that links for Medical Cannabis Awareness Week. And if you have any questions, you can always email us at info@safeaccessnow.org. And thank you for spending your lunch hour with us, and we will see you next week.